Good morning, students. Today we will learn about the moving, lifting, and transferring or turning of the patient from bed or any one place to another place. Okay. So in previous session we already discussed about the some terms and different kind of the position using for transferring of the patient. Okay. So now today we will learn about the transferring of the patient and moving and lifting. So first of all, that is how can patient can move with help of the assistant. So we can, as a nurse, we can assist the patient to move up in a bed. So how we can help to the patient? So first of all, if the patient can assist, have the patient grasp the headboard and bend his knees also. So as an assistant, we can help the patient from knees, and one hand should be placed under the knees of the patient and another for under the shoulder or back area of the patient. So we can support from the back side as well as the lifting for the knees area, and patient can place their hand over the headboard. Okay, so place your forearms under his shoulder and knees. As I said earlier, that is our, as a assistant, our one hand should be placed under the back, means on the under shoulder of the patients, and another hand under the knees area, so we can lift up the patient easily. Okay, and lift at the count of the three, so it will be not strain on assistant also, and moving easily for the patient. Next, that is the moving up in a bed. So how can patient can move up in a bed? So if the patient has a trapeze, means in figure that is shown that triangular device is. Okay, so by the help of this triangular device, patient can put their hands over there, and from their trapeze have the patient grasp their hand and trapeze and bend the knees. As a assistant help under the knees area and shoulder of the patient, and patient can lift up whole body weight from the help of the right trapeze. So this can, the patient can moving up in a bed. Next, that is the using a lift sheet. So if we want to transferring the patient, we can transfer the patient by the help of the lifting sheet. So what is the use of that lifting sheet? A lift sheet makes the lifting easier as shown in image, that is two assistant and nurse also help for the lifting of the patient by applying this lifting sheet. See, in their hand there is a low rolling of the sheet, and it can help to prevent the friction of the skin against the patient's skin. Okay, so bed surface and the patient's skin not be friction anymore, so it can prevent it by the lifting sheet, and takes two workers to lift. So in this procedure, two assistant or worker can help for the lifting from bed to the patient. Then use for persons who cannot help with the moving. If person can't help with the moving, then they can assist for the helping of the patient by the using of the lift sheet. Okay, next, that is the moving the patient to side of the bed. If person want to moving but in bed itself, then how we can changing the position or moving of the patient in bed itself? So the person is moved in segment as shown in image. Okay, so in three image, that is a different kind of the position or moving is placed. So in first image it is shown that the move the upper part of the body, patient's body toward you. So as a assistant or as a nurse, we can apply our hands under the patient's shoulder and back, and to patient's body with towards our body, so we can easily move up with our area. Then in B image, that is middle part. In first A image, that is the upper part of the body. In B image, middle part of the patient's body. And in C image, that is the lower portion or lower extremities body toward you. So by applying this step one by one, we can easily move the patient in different segments. Okay, next, that is the turning a patient. So how we can turn a patient in bed itself? If patient having a more body weight or more more heavy body of the patient, then how we can applying or turning the patient. So first place the patient's arm across her chest and cross the leg that farther from you over the other leg. So as shown in image A, assistant or nurse can help the crossing of the leg and arms of the patient across the chest. Okay, so by that we can easily turn up one side to the patient, and as shown in image B, we can support the back area of the patient and turn toward our side. Okay, so this can be easy for the turning of the patient. Third one, that is the proper positioning for the lateral. So as we discussed in previous session that different positioning, we learned the lateral position also. Lateral position is also known as a one side lying position. So in this image, that is apply. So arm and leg with supporting of the pillow. So we can relax our body, and thus we can provide the comfortness to the patient of the lateral position. Okay, so by after turning of the patient we can apply pillow for the comfortness of the patient. Next, that is the log rolling. So we already discussed in previous slide, that is the rolling sheet. So we can turn up the patient by the help of the rolling sheet. Okay, though so log rolling is a device which is used for the turning or moving of the patient in bed itself. So a patient who has a spinal injury or spinal surgery, it must be kept with in a good body alignment when the turning. If patient want to turning or moving in a bed, and by maintaining the proper alignment, good body alignment, in that case we can applying this log rolling for proper maintaining body alignment. If patient having, but patient can't do that self, okay, because patient having a spinal injury or spinal surgery, in that case they can't move their body by themselves. So in that case we can apply this log rolling sheet, and by that we can turn up the body of the patient in a bed area. So using the lift shift with the person turn into one motion. So here three assistant is there for the log rolling by for shifting of the patient, okay, moving one side. So it takes 2 or 3% to safely log roll a patient. So not only one assistant, but it can take 2 or 3% for safely log rolling of the patient. Second, that is the assisting a dangle. So how we can assisting a dangle? So in the image it is so dangling refers to the sitting on the side of the bed with the feet hanging down. So as shown in image, that is a person is a one side lying down and on a bed, and with the feet is hanging down. Okay, so in cross manner legs are placed and it will be hanging down on the bed. So this is the dangling. So it can apply into the sitting position also in the bed area. So do not leave the patient. This is some criteria or guidelines for the assistants or nurse, because if patient is alone in bedside, that in that case, if vital signs are down, patient can't moving or turning their body themselves. So always do not leave the patient alone when dangling procedure is applied. Then having the patient cough, deep breathing and exercise their leg muscles when dangling. So while applying the dangling, it refers the patient, if patient having coughing or deep breathing or exercise, the leg muscles are heavy. If do not leg muscles in dangling process. So if the patient become dizzy, lie him down. Okay. So if patient feels some dizziness or giddiness, we can apply into the supine position. Okay. So they can comfort themselves and relax. Then check the person's pulse and respiration. We have to check the vital signs, that is respiration, pulse and blood pressure. Okay, if any falling down, then we can apply or relax the patient's body. Okay, so this is some criteria while applying the dangling. Next, that is the assisting the patient to transfer. If we want to transferring the patient from bed to stretcher or bed to wheelchair, then how we can help for transferring? So first of all, there are some criteria for transferring a patient between chair to bed or bed to chair. So your patient may need to be transferred between bed and chair or wheelchair. Remember these all following points. So first of all, that is the patient should wear a footwear with non-skid soles to avoid the slipping, because of the floor surface of floor will be slippery. So in that case, always advise the client to wear a footwear with non-skid soles. So the chances of falling down should be avoided. Okay, so patient can't slip into the surface area or floor. Okay, so first point, that is always wear footwear to the patient. Then always get help if the patient is unable to assist or is very heavy. If patient's body is heavy or patient can't do themselves turning or moving, then as a nurse or assistant we can help out and encourage the patient to help however whenever possible. So always never leave alone the patient and always keep with the patient and advice for encouragement. If you are moving a patient to vinyl covered shed, cover the seat and back with a bath blanket, and this will make the patient more comfortable by absorbing the perspiration. So this is the criteria for the wheelchair or covered chair. Okay, so we can moving a patient applying the vinyl covered chair and also cover the seat area also and back, because it can absorb the perspiration and feel patient comfortable. Then placing a pillow under the seat will serve the same purpose. Okay, so by providing the comfortness we can applying the pillow on seat and determine if the patient has a weaker side. If so, allow the patient to lead the strong side. Make sure the patient can see the chair and bed that you are transferring to. So patient have to clear that vision that they want to moving or turning from bed to stretcher or stretcher to bed or chair. Okay, so always guide the patient for any activity also. Then do not allow the person to put his arms around your neck. Okay, because if our vein or artery is put by placing the hands, so don't allow the patient to put their arms under our neck. Then your make sure you lock the wheels on the bed and wheelchair. Yes, this is the most important point, because every wheelchair and bed having a lock-up system. So if while we turning or moving the patient, always lock up the chair or bed. Okay, so the chances of the falling down we can prevent it. So in image it is shown, that is the brace the patient knees area and fit with your knees and feet. Okay, so assistant can help by the placing them hand under the patient's back area under the shoulder, and then pull up the patient's body weight. Okay, so bring the patient to in a standing position. So by this we can applying the principles of the moving or turning up of the patient, we can transferring the patient easily. Then rules for the gait belt or transferring belt. So how we can applying the transfer belt to the patient, because it is a safety belt. We can provide the safety to the patient from falling down, okay, or any injury. So always apply the belt around the person's waist area over the clothing. So it can't friction to the direct patient skin also. So over the clothing we can apply the person's waist area. The safety belt we can apply. So tighten the belt. It should not be too loose or too tight. It should not cause discomfort or impact the breathing of the patient. This is the most important criteria, that is make a patient comfortable, because if belt is too tight then patient can't breathe. Okay, breathing difficulty is there, and making discomfort to the patient. So always mm, keep in mind this point, that is a belt should be not too tight or too loose. Then you should be able to slide your open hand under the belt. So as shown in image, our hand should be under the belt. One hand should be under belt. This is the measurement of the tightening of the belt. Then place the buckle slightly off center in the front. So buckle should be in a front side, and do not use with the patient with fractured ribs, abdominal surgery, or having the breathing difficult. We can't apply in this condition or client patient. Okay. So if patient having a fractured rib or abdominal surgery or having a critical difficulty, we can't applying this belt or transferring belt to the patient. So as shown in image, we can apply the transfer belt to the patient, and by the applying the transferring belt, we can easily transfer the patient and get help for standing up in position or moving from bed to chair or bed to stretcher. So it is easy and provide safety to the patient also. So it is very helpful for the patient. So these all are criteria for moving, lifting or turning of the patient. Okay. So you should keep in mind as an assistant or nurse for transferring of the patient. So thank you everyone for listening me, and if you find any doubt you may notify to me. Okay. Thank you.